Let's move on to comments made today by the Chief Health Officer in Queensland. Very positive comments from what I was reading of what he had to say. He says the Gold Coast past its peak, Queensland approaching its peak. Brisbane, that is, I should say. And then you go to Sydney and Melbourne as well. The view is that they've passed their peaks, as the ACT has, and so on. The South Australia have been doing very well too. Are you feeling optimistic as we are hopefully past the worst of it when it comes to this Omicron wave?
Well, look, I think there is good reason to hope that we've passed the peak. We're not sure how long the peak will last. I mean, there are still 5,000 people or thereabouts in hospital around the country with COVID. The peak of hospitalisations in New South Wales was only Tuesday, so it's not yet sufficient time, I don't think, to be completely confident we're past it, but the signs are good. Victoria, there are still more people in hospital than there have been at any time during the pandemic. Obviously, that's the case in Queensland and South Australia as well. So, around 5,000 people in hospital. Over the last 2 days alone, more than 150 people have lost their lives. So, dozens of Australians are losing their lives every day to this disease. And, there's no sense that is going to drop off very, very soon, because there's obviously the lag factor there. So, I think there is good reason to hope we've passed the peak, but that's not to say that there's not a very serious crisis still gripping the country. I mean, this is a very serious wave we're facing. Pressure on our hospitals we've not seen before in the pandemic, and a death rate that is very, very serious and obviously resulting in enormous widespread tragedy, grief and loss. Aged care is still in a very difficult position. There are outbreaks in hundreds and hundreds of facilities. Hundreds of people in aged care have died, over 200 just this month alone. They can't get the rapid tests they were promised. They're having difficulty getting PPE. And next week, I don't think still that there's really confidence among Australian parents that there's the national plan to guarantee as far as we possibly can that school returns safely. Still only 1 in 3 primary school aged children have been given their first dose of the vaccine. There's no national plan from Scott Morrison to make sure that teachers and school support officers have all received their booster shot. There's no national plan for ventilation, mask wearing protocols and so on and so forth, because yet again Scott Morrison said, well, that's not my job. That's the job of the states yet again. So yes, let's be hopeful that we've passed the peak, we've passed the worst of this period, at least in case numbers. But frankly, there is still a lot of tragedy, a lot of pressure on our hospitals, and a bit of a way to go yet, I think.
And just quickly, we're almost out of time, but in terms of rationing what we do have in terms of the rapid antigen tests, I know the supply is still well short of demand at the moment, but what needs to be the priority, in your view, as to where these tests go right now?
Well, pretty much the same priorities we've had right through the pandemic. I mean, they're guided by good health advice. The people in our community most vulnerable to this variant, the Omicron variant, are still older Australians, particularly those in aged care facilities. The fact that they're not widely available in aged care, and that's what aged care workers and providers do say across the country, is extraordinary. The fact that the Australian of the Year had to make the call on Australia Day, or the eve of Australia Day, for all NDIS recipients to receive rapid tests free of charge, again reinforces the vulnerability of many Australians living with disability, the fact they're way behind on vaccines and so on as well. So, we do need to recognise there are parts of our population who are particularly vulnerable. But I do say again, the Prime Minister was warned many months ago that we were going to need huge supplies of rapid tests. And the fact that we are in a position as a country of having to think about rationing these things just reflects the failure of Scott Morrison to listen to that advice and to take responsibility to ensure an adequate supply.